Our first thought with this study is that it's important for mental health professionals to talk about a whole variety of sexual behaviors because we know this is a huge issue within the community, lacking the space to talk openly about sex, let alone kink. So we developed the following item on the screen, providing examples for clarification of some terminology to assess a professional's comfort in discussing a variety of sexual behaviors with their clients. This is the first section of our scale creation, and we call this the Comfy with Kink scale. Second, a major resource that we utilized when creating our scale was the Kink and Polyamory Aware Professionals website. They provide a directory of therapeutic, medical, and legal professionals who have stated that they are knowledgeable about and sensitive to diverse expressions of sexuality. They also provide many resources regarding sex positive support for kink and non monogamy, including the kink clinical practice guidelines, which are meant to deepen understanding of best practices when working with folks with kink interests. These guidelines were created after acknowledging the lack of training and education, as well as the stigma that exists surrounding kink sexualities in an attempt to fill that gap and address unmet needs. So the Kink Clinical Practice Guidelines Project put together 23 guidelines that outline quality and desirable professional practices and discuss the knowledge, skills, and attitudes that are important for providing culturally competent care to the kink community. We adapted each of these ethical standards into a survey item for our scale, which can be answered using a Likert scale indicating the degree to which a professional agrees with that statement. For example, Guideline 18 states, clinicians understand that societal stereotypes about kink may affect the client's presentation and treatment and the process of therapy. We adapted this guideline into a scale item that reads, societal stereotypes regarding kink may influence a client's presentation and treatment. And next we used the McCass as an auxiliary scale for our scale creation. The McCass is a self-report inventory to examine one's multicultural counseling knowledge and awareness. It is made of 32 items and uses a 7-point Likert scale. It's broken down into 2 sections, an awareness scale and a knowledge scale. And I've included an image on the slide here that shows the first few items of the McCass. So with combining 3 components of our survey, we have first the Comfy with Kink scale item, then our competency specific items based on the kink aware professional clinical practice guidelines, and the auxiliary scale items from the McCass. We hypothesize that those who possess greater general cultural competence will also possess greater kink cultural competence.